Tuberculosis remains a serious public health issue globally. 2 people die from TB infections each hour. Despite effective treatments being available, African countries bear the biggest burden of these infections, and Kenya is among these countries. My name is Usna Mohammed, and on this episode of Health Watch, we focus on the journey and history of TB diagnosis and treatment in Kenya. Tuberculosis has been a long-standing health concern in the world since the ancient times.
It's known that TB probably has been present in the world for many years because some of the studies in the Egyptian mummies, the bones, have shown that TB was present in those bones, which are more than 4,000 years ago. And maybe it was not diagnosed then. Everybody thought these TB were worms, they were cast from people, there was some devils cast upon you, and you just grow thin and thin. Nobody knew. For a long time, there was no infection. Infection theory is a very recent thing. The old thing, everybody knew everything was a curse. And or eating some blood you eat. In fact, they said maybe somebody has make your blood impure.
Dr. Alwach is a chest specialist. He has been focusing on tuberculosis particularly for the last 56 years. According to him, TB found its way to Kenya in the early 19th century.
The story of TB in Kenya is very interesting. Early reports show that there was no TB, at least in the mainland of the country. However, reports in the early 19th century indicate that TB arrived at the coast of Kenya, brought in by the Arab, Asian, and European slave traders. And for a long time, it was only diagnosed at the coast province.
However, it wasn't until the late 19th century, with the arrival of European settlers, that TB gained some significant attention. The disease ravaged both the local populations and the colonial elite, underscoring its devastating and indiscriminate nature.
TB was a devastating disease. It killed many people. At one time, it was known as the captain of all these men of death. And most people who had TB for many years died slowly. It was called consumptive disease because the patients wasted away slowly until they were completely consumed and became very thin or skeleton and eventually died. Later on, particularly during the First World War, there was evidence of TB in the interior of the country. Early reports of TB were made when the African recruits were being examined before joining the First World War. They were all camped in a place in Nairobi, and since there were people who were going to carry luggage for the European fighters, they were known as carrier corps. And this carrier corps camped somewhere, which is now known as carrier corps. And they were x-rayed, and some of them revealed TB in their x-ray. Since then, in the early 40s, late and early 50s, several cases of TB were discovered in many parts of the country, particularly in the central province, Fort Hall, now known as Murang'a, and in Nyeri, and in the western part of the country. TB was then familiar among all tribes, and each tribe gave it a name. But the most important thing is that it was the only disease that made people lose a lot of weight. So whenever anybody was seen growing thinner and thinner, it was assumed correctly, and coughing, it was rightly assumed that he was suffering from tuberculosis. Likewise, just in the late 20th century, when HIV arrived, the epidemic, if you're losing weight and also coughing, most likely it was assumed, and often correctly, that you're having TB.
Harambe!
After Kenya's independence in 1963, efforts to address TB took a new dimension. The government prioritized healthcare initiatives aimed at improving access to diagnosis and treatment. According to the World Health Organization (WHO), the National TB Control Program was launched in 1965 with focus on early detection, standardized treatment regimens, and public awareness campaigns. Despite these efforts, TB remained a threat and not too tough to crack.
The treatment of TB for a long time was very elusive, particularly before 1843 and then 1843 when the 1882 actually, when TB was actually discovered to be caused by a germ known as mycobacteria, or the TB germ. Before then, nobody knew the cause of TB, and you assumed that it was some bad air or bad omen or something in the air that somebody breathed and made him cough. Those treatments, particularly in the early 19th century, considered nothing but just giving people good nutrition, fresh air, and just a lot of rest. In fact, most places they build so-called special spas or holiday cottages where people with TB were sent in Europe to go and kind of rest and get cured. The same thing was also transferred to Kenya, where in every major province those days, we had a hospital which was dedicated for TB, known as Infectious Diseases Hospital. In Mombasa, the famous Portrees Hospital was built overlooking the ocean in a very breezy area because they needed some breeze air. In Nairobi, ADH was also built on the top of the hill, currently is now known as Bagadi Hospital. It was surrounded by a lot of trees. Those days, the many buildings you see there were not there.
Tuberculosis, or TB, is caused by a bacterium called Mycobacterium tuberculosis. According to the Centers for Disease Control and Prevention (CDC), the bacteria attacks the lungs, although the TB bacteria can attack any part of the body, such as the kidney, spine, and brain.
TB can affect almost every part of the body, but the commonest part, which is almost 70%, is the lungs. But it can affect all other parts. So one cause of kidney disease is a cause of infertility when it affects the reproductive organs of the females. Probably one of the commonest cause of infertility. It can cause GIT problem. It can cause meningitis, TB meningitis. It can cause tumor in the brain called tuberculoma. In fact, it can cause almost everything except in three parts of the body, namely the teeth, the hair, and the nails. Those are the three components in the body that are not affected by TB germ. Otherwise, any part of your body, your skin, will be affected by TB.
The bacteria spreads through the air from one person to another. When a person with TB of the lungs or throat coughs, speaks, or sings, they get suspended in the air. People nearby may breathe in this bacteria and become infected. However, not everyone infected with the TB bacteria displays the obvious signs. Two TB-related conditions exist, which are latent TB infection and TB disease.
Most of the TB germs settle sometimes within the lungs and become what's known as dormant. They go to sleep, and they're there. They do not cause any symptoms. You don't have any disease, no fever, no weight loss, but you've got the TB in your body, and they're just lying somewhere in the lungs. And that is what causes latent TB. If you get TB germs and immediately you get symptoms like coughing and loss weight and sputum, then you have TB disease. TB, which was in your body and lying dormant, suddenly becomes active. It found that there's a fertile ground for it to grow, less immunity in your system. That is causing the so-called endogenous infection of TB. Endo means coming from inside you, as opposed to exogenous, when it comes from outside, from somebody else, your neighbor, or your office mate, or your housemate, coughing and giving the infection.
According to Dr. Aluoch, almost all Africans carry TB germs.
In our community, by the time you are at 3 years of age, more than 30% of the children have been exposed to TB germs. So most of them will be having positive tests for latent TB.
Tuberculosis is a serious public health issue in Kenya. According to government data, about 120,000 people develop TB annually. 48,000 of these are HIV positive. The disease kills 18,000 people each year. With a casualty rate of 6%, it is the second biggest infectious killer behind COVID-19, according to the 2023 WHO report. Nearly 2 people die from TB each hour, despite available yet effective treatment options.
TB continues to pose a significant public health threat, particularly in vulnerable and marginalized communities. Prioritizing early detection, contact tracing, and infection control is crucial to minimizing TB's impact and preventing new cases.
On the 24th March this year, Kenyans joined the rest of the world in commemorating World TB Day with eradicating tuberculosis infections, pacing the theme of the moment.
2023, we notify 1,617 drug sensitivity to TB cases. That is equivalent to 14% of this being children. Up to 60% of our TB patients are undernourished.
Wale ambao wanaathirika wengi zaidi ni watu wazima, watoto ni wachache, na waambukizi ni watu wazima.
Wito wetu kama kaunti ni kuwaeleza watu ambao wamekuwa na shida na kifua waweze kujitokeza, waende pale hospitali, watibiwe ama wafanyiwe ule uchunguzi, waweze kujua shida yao ni kitu gani. Kama ni TB, tuko na matibabu.
Sana sana ime affect ya watu wanafanya kwa bus stations. Hawa watu wana transport industry. Kwa sababu wao kwanza hawataki kuja hospitali. Hawa wako na ile stigma.
According to Siaya TB coordinator Mary Wambura, the county registers more than 3,000 new TB cases annually, making it one of the high-burden counties.
Every year, we always register between 2,500 to 3,500 TB clients whom we treat. Some die along the way, but majority of our cases, of our clients, we cure them, and our cure rate is at 92%.
In 2022, Nairobi County recorded 12,165 cases, with 83 of them being drug-resistant strains. Embakasi and Kibra recorded the highest rate of infection in the city due to higher population of residents. In 2022, an estimated 10.6 million people fell ill with TB worldwide, including 5.8 million men, 3.5 million women, and 1.3 million children. African countries bear the biggest burden in TB infections. Kenya is ranked among the high-burden countries in the continent, taking position 30 out of 54.
If you're coughing frequently for more than 1 month with no other obvious cause, you're not an asthmatic, you don't have bronchitis, and you may be having fever, but more importantly, if you're losing weight, then you should suspect yourself having TB and go for TB test. The commonest TB test is examining the sputum, ile kohozi.
Despite the persistent challenges, Kenya has made significant progress in combating the disease.
The cut in duration of treatment was soon made so that by the early 60s, we're now treating TB for only 18 months. And in Kenya, we developed a certain combination of drug. It was known as thiazine. It was coming in, it's a tablet of 3 pink tablets. You take 3 pink tablets every day, and they're packed in a plastic bag, which you take for 1 month. But before taking the tablet, there was an injection called streptomycin. Most patients were given injection of streptomycin for 1 month, sometimes 2 months.
With little to no medical advancement in technology, Dr. Aluoch recalls vividly the injection treatment process.
At the beginning, we did not have disposable equipment. We didn't have disposable syringes or needles. We didn't have autoclaves, proper autoclave for the sterilizing in the outpatient, particularly in the rural areas. We didn't have electricity in those rural areas, so we had to use paraffin stoves. Those good old days, most children in the village were walking around with no shots. They were just, maybe at best they were having a shot, or sometimes not even a shot. They were actually naked in the villages, so they sit. So their bottoms come very hard. They sit on stones everywhere. So when you give the first injection with a new needle, the needle feels quite insulted. By the time you give them 10 needles, the needle will now be bent. When you give the 12th injection, it's like cutting somebody with a knife.
In the recent past, Kenya faced the emergence of drug-resistant TB strains. This posed threat to TB control efforts, with such as inadequate healthcare resources, poor treatment adherence, and HIV co-infection, driving up the rise of drug-resistant TB cases. The journey of freeing oneself from the shackles of TB is not a walk in the park, yet necessary.
Any default or taking your drugs irregularly cause a lot of problem, especially it results in what is known as TB resistance or multiple drug resistance TB, even sometimes extra resistant drug resistance TB, which is very difficult to treat, treated by medicine which are very toxic.
The Ministry of Health earlier this year rolled out an ambitious plan to eradicate tuberculosis by 2030. In a new 5-year strategy, the rollout follows disturbing statistics that indicated that the disease has been killing more people than HIV, AIDS and malaria combined.
In the year 2022, Kenya recorded a staggering 90,841 TB cases. This is a whole constituency. A significant increase from 77,854 cases reported in 2021.
Until now, the exact number of people suffering from tuberculosis is unknown in the country.
Despite the availability of drugs, there's still, because of the inadequacy of our health services, there are several people in the community who are having TB, but they never get to the hospital to be diagnosed. Or if they go to the hospital, a lot of them are missed. So that for every 10 people with TB in the village, probably only 6 may get to the hospital to be diagnosed.
The historic journey of TB in Kenya reflects both the resilience of its people and the complexities of addressing a long-standing public health challenge. While significant strides have been made, much work remains to be done. Husna Mohammed, KTN News, Nairobi.